It's time now for bridging culture and health in the midst of COVID-19 Radio Town Hall. Coming your way over 100.7. As I say, a very pleasant welcome to our moderators, Dr. Dwight Mullins, UNC Asheville Professor Emeritus, and my daughter, the one and only, Lakeisha McDade, with the Dogwood Health Trust. Good evening.
Good evening.
Hello, how are you?
All right. I am just fine, and I can hear you just fine.
You know, Brother Hayes, we're all recognizing the social distancing thing.
All right.
But it's good to be with you.
All right, Dr. Mullins, I want to turn it over to you and Lakeisha as we venture into a new way and a better way, a great way of communicating with our community.
I appreciate that. I really appreciate the chance to talk to the community. I've done State of Life Asheville through UNC Asheville and through your station for a number of years now. And the question came up, racial disparities in education, racial disparities in housing, healthcare, criminal justice, economic opportunities. And so the question came up, why wouldn't there be racial disparities, or what does race look like now that we have the COVID-19, the coronavirus among us? And that's the question that drives our meeting today. Keisha?
Yes, and we recognize that when we get into unprecedented and unique times that our community is one of the first to fall through the cracks. And so we want to really ensure that we are giving information, giving honest and real information, because we know when we learn and when we have the information that we will make every attempt to do better. And so that's what this conversation is about. How do we really do better? How do we wrap ourselves around all of this information and support each other so that we can lift the entire community? And
Can I say one more thing about this? This is all brand new. I mean, none of us have ever been through anything like this pandemic. And so as we try to produce this program and as we go through our motions in the community to be safe and healthy, please be patient. We're working through this too.
Yes, absolutely. We are asking and extending grace. So appreciate you bringing that up, Dr. Mullen. We're going to move to introducing our panel for this afternoon's discussion. I'd like to introduce Reverend Alfred Blunt, who is the pastor of Tridestone Missionary Baptist Church.
Good afternoon. I'm happy to be here and to be a part of this panel.
And, you know, Reverend Blunt, one of the things that we're going to ask all of the panelists as we go through is, what does this new normal look like? What do you think? What do you know about what's going on in our community? So as you were going around introducing, please consider that question.
Okay. From the looking at it from the faith community, we have to take into account that we are a relational body. We are in relation with one another. So with the COVID pandemic that's going on, we have to look at how do we continue to make connections with each other. How do we do that in a safe way? How do we continue to feed each other spiritually? What does ministry is taking on a completely different look? It's not anything that we're used to. We've had hits and misses as far as Facebook online worship services, but now in order to connect with our people, we've got to do different things, whether it be Facebook, whether it be conference calls, different types of medias that are out there in order to continue to have that relational connection that we've become accustomed to in our faith community.
Thank you, Pastor Blunt.
Our next panelist is Deion Greenlee Jones. And for our listening audience, you need to know this is where information comes from. She is working with 211.
Thank you so very much. United Way has really become embedded in the county's emergency operations center, as well as NC211 has basically been deployed by the governor to be the information resource for individuals who are struggling. As we talk about disparities have become even more to the forefront for United Way to address those. And NC211 is one of the major ways that we're doing it. Individuals can call 24/7, 211, and can get on the line with someone who will help them try to find things to meet basic needs. Interestingly, 211 has handled a total of almost 18,000 calls since it's been activated since March the 18th. And most of the users have called about food and motel payment assistance and rent payment assistance. And interestingly, we are hoping that people who are in need will call 211 because that puts in motion a response. For example, our 211 referral specialists not only helping people get connected to resources they need, they are also taking note of the gaps. And when the gaps got up to the office of the governor about people who were needing housing, those things, it put in motion policy changes so that individuals could not be evicted during this time period. So again, we're always trying to advocate for our callers to just be informed and be able to call 211 in order to get that information.
Thank you, Deion. 211 is an absolutely amazing resource for this community and really is a lifeline for many of the members for our community. So thank you for what you all do. I'd like to introduce Rod Conley, who is the barber and owner of Kings and Queens Hair Studio. How are you doing, Rod?
I'm doing pretty good. How you doing?
Doing well.
I was just wanting to be a part of trying to get some of the information out to the community and some of my customers. A lot of us, what I'm getting back is they don't really know the value of keeping social distance. Even some areas where they are, they're basically saying it was hard for them to keep social distance, considering some of their living conditions. So.
Yeah, that's definitely very real.
Yeah, so I think a lot of people are just trying to figure out some ways to help prevent like some of the gatherings or just certain circumstances that they're involved in.
I appreciate that, Mr. Conley. I'd like to hear some more from how that actually worked out as the show goes on today. Our next guest is Felicia Hill. She is an RN at Mayhem.
Good afternoon, everyone. And I am so appreciative to have this opportunity to be on the call. What I will say is some of the things that we're focusing on at NAHIC, of course, is just making sure that our patients and also other patients have access to care. One of the important things that we think about is, specifically in the African American community, is risk factors for COVID or related to COVID. One of those is diabetes, or what we call sugar, in my family, and those with heart disease or who take the fluid pill, high blood pressure and asthma, and diseases that impact your immune system, which is the part of the body that normally helps you heal when you're sick, like lupus or multiple sclerosis or sickle cell anemia. And so as we look at these numbers and understand that in North Carolina, African Americans make up 22% of the population, but right now, statistically, we make up 38% of the deaths related to COVID-19. Some of that is related to less access to care, being uninsured or underinsured, or transportation problems, i.e. not being able to have a bus route to take you to your appointments. African Americans are also less likely to have a job where they can telecommute. They're more likely to be enrolled that require them to be on the front line. So as we think about those things, prevention is the key. Because as we think about these risk factors, once we get it, it's much harder for us to avoid those serious complications. And sadly enough, as the statistics have said, possibly death related to this. We've also seen a great uptick in mental health problems. Those who have not had anxiety disorders before have them now. Those who do have anxiety disorders, they are worse. Depression is also, there's an uptick in overall sadness from the social isolation. So we've encouraged patients to use your telephone and video apps and continue to engage in social networks. And we have a psychiatric and behavioral medicine providers at MAHEC who are available and open and taking new patients. The last thing I want to bring up is just clinical access and having access to testing when you have more than a mild illness. A mild coronavirus illness is usually somebody with like cold symptoms, but if it's severe, you have difficulty breathing and you have high fever and a severe cough. And so what I can say is MAHEC, our family medicine department, our psychiatric department are all open, and you don't even have to come in. We have telehealth options for patients to be seen, so that our goal is to protect and keep the community safe and stop the spread of the virus.
Thank you, Felicia. We will definitely talk about several of the points that you hit on a little bit later, but I especially want to thank you for bringing up the piece around mental health and depression due to the social isolation of social distancing. I think that's really, really important because culturally that is a shift for us. And so we'll talk about that more in just a little while, so thank you. Next up, I'd like to introduce Mr. Gene Bell, who we all know for as being an active community member and was the former leader for the Asheville Housing Authority. Mr. Bell, how are you doing today? Mr. Bell, you're still with us?
Yes, I'm here.
Okay.
Can you hear me?
All right. Yes, we can hear you now.
Okay. So first, I want you and I to get with John after this is over and dispel his statement about him being your daughter. So we can get that. Okay. So that's my role. Okay. So I want to thank you all for even consider doing this and for your efforts. But the big concern that I have is that we're already disenfranchised and have been for many, many, many years. And our norm was not the norm in the beginning. So there's some things that I think we have to be prepared to address. One is the summer loss for our kids, so we've exacerbated that they're out of school longer now, twice as long as they normally are. And when we go back to school, we've got to have a plan in place. Now, I think I have some stuff with Dwight, but we've got to have a plan in place to get our kids ready to go back to school. Number two, the economical aspect of it, it just moves us farther away from the center, and we've got to do something about that. The monies that the federal government is allocating is maybe a patch. I don't even believe it's a patch. You know, you can't move people out of where they need to be and then expect them to get back with everybody else with $1,200. That's pretty ridiculous. And my last thing is on this spacing, we also have to realize that the majority of people that are economically disadvantaged don't have air conditioning. And it's not as likely that they're going to stay in the house in the heat of the afternoon as people who have air conditioning. And normally they don't have spaces where they live that's large enough for large gatherings and continuous spacing. So I think we have to keep all of that in mind when we think about correcting and improving the plight of African Americans. We've got to think about the circumstances that exacerbate that. That's what I have to say.
As usual, Mr. Bell, totally valuable. I appreciate your insight, and we need to come back to it as time allows. Our next guest is Libby Powell. Libby is a friend, a teacher at Asheville City School, and now she is directing the WRES-LP here in Asheville. Libby?
Thank you, Dr. Mullen. So first I want to let you all know that at the WRES-LP, we are providing child care for first responders, and we're also working with Buncombe County and Manna Food Bank to continue the food markets weekly. So as Dr. Mullen alluded to, before becoming the CEO of the WRES-LP, I taught at Isaac Dixon for the past 14 years, and like Mr. Bell, I'm very much concerned not only about the disparities in community, but about the further disparity that's going to be created for our kids as they've been out of school, and we'll be out of school for another month and a half, and then we'll have the summer. So I'm hoping that we can address some issues with creating some consistency with at-home learning, creating schedules, and putting systems in place to support our children and youth.
Thank you, Libby. And we will, again, be talking about a little bit deeper, particularly around our children and our community. And lastly, but certainly not least on our panel this afternoon, we have Sheriff Quentin Miller, who is our Buncombe County Sheriff.
Thank you for having me. I would first say thank you to everyone in our community who is staying home and keeping our first responders safe from this virus. But I also want to thank the nurses and the doctors, grocery store workers. Thank you. My message today is this is serious. It's very serious. This virus is serious, and I know that sometimes we don't really take things serious until it affects someone we know or one of our family members, and then we, now we're sure that something. Sometimes we think it's a movie or something, but I will assure you that this virus is real, and so I'm here today to emphasize how serious this is, that our entire community take this as being serious. And I know that we have challenges, and I know that Easter Sunday is coming. I know this is a very meaningful time for our community. It's a meaningful time for myself also. But the Easter services, the last I've heard is the message has been that they will be able to do drive-up or drive-through services. And I just still want people to stay safe, remember the physical distance that we're asking for, and also remember that we're asking that, the faith-based community please observe the requirements under the county's COVID-19 order. So I'm asking you to stay away from, passing the tithing baskets during the communion. And we're still, again, talking about how do we keep our families safe. And I just want to ensure that everyone understands how serious this truly is.
Thank you so much, Sheriff Miller, and you're exactly right. I mean, there are things that we'll talk about that we can do as individuals to keep ourselves and each other safe. The thing about COVID-19, it's not just about us as an individual. It's about the people that are around us that can be impacted and affected. And so I'd like to follow up and move into this next segment as we give the group some questions. And you were talking about the faith-based community. So Pastor Blunt, I'd like to ask you to describe some of the things that you all have done at Tridestone to really ensure that we are all individually and collectively responsible for being safe.
Well, first of all, we have gone to live streaming our services on Sunday morning on Facebook. We have a very limited number of people who come to the church to make sure that those things are taken care of. We're also asking people, as far as those that are supporting the ministry of the church, to send in their tithes and offering. They can do that through mail. We're also in the process of trying to get a Givelify set up so that they can do that online. So just trying to make it where they can still do the things that we normally do on Sunday without actually having to gather together and do these things as a group. And so far we've had great success as far as people doing that and taking the time to make sure that, we're continuing to do what we need to do as a church, but doing it in a way that is safe.
All right. Thank you so much.
One of the things I wanted to address while we have a minute are the rumors and the problem ideas that may be floating around in the community. Like when this thing when it first started, when COVID-19 first hit the community, I heard that Black folk couldn't get it, that somehow we were immune to the virus.
Yeah.
And we need to understand that that's not right. And through the hard work of Buncombe County and folks we've working with to organize this conference, yesterday we were able to get the numbers for Buncombe County. How many of us are officially sick? How many of us tested positive? And it turns out that Buncombe County, that only 2 of us, African Americans in Buncombe County, have been tested positive for the COVID virus, or COVID-19. We need to think about that. Are we getting tested sufficiently? But another part of the rumors that are floating around is that only old people can get it. You have to be elderly. They're the ones who are most prone to be affected by the virus. And the data yesterday said this, that 46%, 25 to 49-year-olds of those who were tested, that's ages. 46% tested positive for 25 to 49 years old. In other words, you don't have to be old to get this virus. You don't have to be one of our seniors. In fact, we have people who are 20, under 50, with the virus. It doesn't discriminate by gender or men or women, equally subject to getting the virus. And so as we're looking at this, we have to spell it. And one of the best ways is by calling 211. And I'm wondering if Ms. Greenlee Jones will get a further comment on what kind of calls we can expect to make if we call 211. What kind of questions can we ask?
Any question. The cool thing, and I'll say cool thing, about 211 is that anyone can call 24 hours a day, 7 days a week. We've had callers call from throughout the state asking about unemployment benefits. We have databases that allow specialists to answer calls from callers about basic needs. If families need diapers, for instance, or if they're concerned about eviction, we have the latest up-to-date information that's updated hourly, sometimes minute by minute, about changes in mandates at the state and national level. So individuals can call with whatever their needs are. And the thing is that if we can't answer the question based upon what we have in our databases, we make sure we try to get them in the right direction to have their questions met. There could be general information from a county if people are interested in trying to reach their local health department or they're concerned about having symptoms. 211 is able to give individuals information to ask questions, answer questions, regardless of whatever the question is. There's no silly question. We are really interested in just helping individuals getting their basic needs met.
Thank you so much. Again, 211 is such an amazing resource to the community, and I appreciate you saying that any question can be asked, because I think sometimes that will prevent us from calling, because we think it's a dumb question, or they won't have the answer to this, or I might be the only one that's experiencing this, when that's not the case. So thank you for clarifying that for us.
And it's confidential. Again, it's 24 hours a day, 7 days a week. And if people speak a different language, we have interpreters. So there's nothing to hold anyone back from making a call.
Great. So I'd like to pivot just a little bit and get the perspective from not only from someone that is sharing the message around physical distance and social distance, but that also impacts his business. And so Rod, as a barber in this community that has served this community for many, many years, and we know the barbershop sometimes serves as the doctor's office, the church, the gathering place for lots of information and social interaction. So how has it impacted you in delivering that message to your clients and those that just come by the barbershop to hang out around the importance of being safe with physical distance?
Well, actually, I think one of the main things is our people really don't recognize the seriousness of it.
Mm-hmm.
And, once they, I was actually surprised that they end up closing like the salons and beauty and barbershops. And people were still calling, even to this day, trying to get haircuts.
Mm-hmm.
Even with some of the assistance that they're offering, the business is for me. They're giving out loans, and so I'm thinking, okay, so I'm going to take out a loan to pay some more debt to create other debt, so I just found some ways to talk with my landlord or whatnot, and probably the option that they gave me was putting on the back end of our lease. And as far as the safety matter goes with my clients, it's still tough. Even with me having kids, it's tough with the social distance, keeping them busy. And I've just been trying to basically take advantage of the time doing things that I haven't been able to do for the park goes. But it's just been it's a rough transition, I believe, for everybody, me, my clients, my business. I've just been trying to do a little bit of better budgeting, and hopefully this passes soon. I think I'm more on the blind because it's the more it carries on, it seems like the more serious it's becoming or has become. And so I'm just in the blind, really, as far as finding some kind of preventive measures or keeping the distance as best way I can, even referring that to my clients and people in the community. Like I said, one of the main things, even when I try to explain to them, they're still telling me, well, how do a lot of the people in Asheville maintain that social distance with some of the circumstances that they're presented with, And I think that's the complication for a lot of people here.
Rod, I want to follow that up a little bit before I go to Felicia for some comments on the medical field. That I wonder if you've been able to have conversations with your clients on the money that's coming from the federal government regarding relief. It's not just, I'm not talking about the unemployment money. I'm talking about the $1,200 per adult and $500 per child. Have you had a chance to talk to folks about that?
No, I haven't. A lot of them actually know. Of course, they heard about it, but I'm not sure if they've actually received it yet or not. Like the stimulus money. Yeah. In fact, that's the reason why I'm bringing it up is that Dion Greenlee Jones, who is at the 211 number, is exactly the person to call for the details on how to make sure all the paperwork is in place so that there aren't any delays when that money starts coming out. That's going to be now with Felicia here, you were talking about the conditions we suffer from as a people, and at the higher rates of high blood pressure, sugar, and asthma, and lupus, and all these things. My question to you is, what exactly can we do about this? Where are our access points? Who can we call? And how do we get the care we need if we don't have insurance?
So the first thing I want to say is I really appreciate the emphasis that everybody has on prevention. Also, I want to reiterate what Sheriff Miller said about this being serious. So as we think about what you said earlier, Dr. Mullins, about people thinking that African Americans can get it, we need to think about it like a cold. Anybody that can get a cold, they can get coronavirus. And so we know how widespread and how easy it is for us just to get a common cold. And so we need to think about this virus along those lines. As far as access, again, MAHEC is open to new patients, as well as seeing our established patients. And we also see patients who don't have insurance and have a charity care program. We have a separate lower level suite that is our respiratory clinic, so that we are able to see our well patients in a separate area where they're not sitting in waiting rooms for a long period of time. They can also be provided again with those behavioral health or mental health or psychiatric services during this time of stress along those lines. But as we think about clinical access, I hear what Mr. Bell said and what everybody is saying, but if we can just figure out a way to work to prevent African Americans from getting these conditions, because when we have diabetes or sugar, when we have heart disease and we're on that fluid pill, it just increases our risk of hospitalization. So the important thing again is this is serious. If you can get a cold, you can get COVID-19. I know that the health department is working really hard as well to support the community and support people in testing and getting tested for the virus. But again, MAHEC's doors are open for those who need to be seen and need clinical access.
Thank you so much, Felicia. I appreciate you talking about, it's anybody can get the common cold. So anybody is susceptible to COVID-19 and really taking heed to that. I'd like to switch for a moment and talk a little bit about, Mr. Bell talked about safety from the perspective of being economically disadvantaged and folks that may not have air conditioning. And, the days are getting hotter, days are getting longer. And it reminds me of a quote that I often have to think about just to sort of bring myself back down to reality. And it says, don't judge someone's choices when you don't know the options they had to choose from. And so I think that's really important to think about. And Mr. Bell, I would love to hear your perspective in particular on, what are some of the things that we need to continue to consider as we try to keep people safe, as we try to get the information out, as we have conversations with our friends and our neighbors. What are some of the things that we also need to keep in mind? Mr. Bell, are you still there with us?
Yeah, can you hear me?
Yes, we can hear you.
Okay. I think Rod made a great point earlier. We will be victimized more now with predatory lenders than ever before, because we'll have more people that work in jobs where they're not being paid the full 40 hours. The advantage that people have who live in housing is that their rent will be adjusted accordingly when they're not working. So the rent helps them not be subject to eviction. But then there are other cost factors that we have to consider. And we're talking about, Rent-A-Center and some of those places that are charging 35-40% interest. So if we could just communicate with people who are vulnerable and try to get them to understand that the consequences are significant. We have a number of predatory lenders with the automobile industry, and they do the same thing. And it's hard to tell people not to do that. If you have kids that you need to take to daycare or need to get to work, So you talk about choices. Some of our choices are our enemy. So that's where the rub is. And I just want us again to remember that there are a lot of people who don't have air. So when we look as we ride by in our cars with the air conditioner on and listen to music, and we're wondering why they're sitting out there, why they're gathered. Well, you know, it's not that they're doing that because they want to necessarily do it. It's just some people don't have a choice. And I want us to be sensitized to that. Those of us who have been fortunate enough to have the economic means to do many things we want to do, most people don't have that opportunity. And we've got to reach back and help those people, and we've got to reach out and try to give them the guidance they need not to continue to be victimized. And that's how serious it is. We get victimized every time something bad happens. And the ones that aren't victimized by it allege they don't understand why other people are victimized by it. And it's just unfair.
Gene, I'm finding that to be the case as I look at the guidelines coming out of the federal, the state, and local government in terms of self-isolation and the assumption that you might have the wherewithal to telecommute, to do your job from home. You know,
yes.
That assumption is not necessarily true.
Yeah, I'm speaking a little bit out of school, but I think Liv is aware. We have developments where people don't have access to the internet. And yesterday, when I raised this point about us going door to door again and giving flyers, somebody said, well, all they have to do is look on the internet, and all they have to do is look at this, and all they got to do is do that. Well, all they have to do is what you have to do. That's not what they have to do. And we can't assume that everybody has the same access.
I mean, and let me give another one. And this is just an interpretation, and, you know, it might be a little sensitive, but since when we avoided sensitivity, sensitive things, is that, you know, we talked about the personal protective equipment, the mask, the gloves, being able to distance ourselves. What does that mean when an African-American man is wearing a mask publicly?
It means what I'm doing is that when I walk into the store, and I've been wearing a mask since I'm 73 and I'm asthmatic and all those other things, but when I walk in the store, I stop and I pull the mask down for a second if somebody sees me. I wait until they see me because I'm very uncomfortable wearing a mask into a lot of stores. And that's the reality of it. Now, we can say they're not going to do this, they're not going to do that. But I've been a black male for 73 years, and I'm not giving anybody an opportunity to hurt me just because they misunderstood why I had a mask on.
And you know, just to follow up on that, it's the idea of the assumptions that follow under these guidelines. And for example, in our community, in the black community, social distancing is easily interpreted as rudeness. You know, that there's something you don't like about me. And really, honestly, this is the time when we've got to do something different about that. We have to social distance.
Yeah, it has different interpretations. I would tell everybody that.
So the question becomes, how do we effectively social distance and prevent the spread of this disease? Because that's the number one health factor, is preventing the spread of this disease. There is no vaccine, and there is no effective cure that we can employ right now. And that's another one of those rumors, one of those things we have to get out there, is that this is a dangerous disease because we have no vaccine, we have no cure. You can only hope to treat it, and you pull through. That's what we're hoping.
And Dwight, let me add, when we do get the vaccine, they're not going in order of color and having black people first. So we know we'll be the last ones to have access to the vaccine.
Or we might be the first ones because we're getting tested on.
Yeah, right. Unless they want to do an experiment.
Dr. Mullins, can I add a comment, please? I'm sorry, this is Libby, but there are a couple of things I just really want to say before our time is up. Number one, we have this one Buncombe Fund, and they're going to be providing loans on money that's been donated. Not really sure how that works, but don't know why it's a loan. This is money that people have donated to help. Number two, when we talk about those people who are disenfranchised not getting what they need, if we know that there are places where, and particularly in housing where people don't have air conditioning, and you've got this one Buncombe Fund where the report today from the Chamber of Commerce was that the people who are benefiting are primarily those people from the 28804 zip code and 28806 zip code. Those places further out from Asheville, not the inner part of Asheville where the housing developments are. Why is there money not being set aside specifically for the people in housing who might need a fan, who might need whatever this thing is that will help them be able to social distance? So there has to be some conversation around how we spread information and how we use the resources that we have so that we can better educate our community and give them the resources and the tools that we all need to be able to practice social distancing. It's not enough to say just do it, but we have to give them the resources to be able to do it. The second thing I wanted to say is that it's also important that I'm sorry.
Let me follow that up with the money, because it just became a point I found out today from a meeting, is that Mountain BizWorks is distributing, they are handling very simplified applications for bridge loans. These are aimed at businesses, small businesses that are prioritized by being owned by women, by racial minorities, and in rural areas for money designed to get them through this house. In other words, these are small business loans that are forgivable. They basically are grants. And they are very simple to apply for, and it may be first come, first served. So I would look that up as quickly as possible for small business owners to cover salaries and wages and other expenses that no longer are being covered because you can operate. Well, what's your second point, Liz? What else do you say?
I'm glad you looked that up, but the people that I'm talking about aren't necessarily business owners, because we know also from data that there aren't a whole lot of Black business owners outside of our hairdressers and barbers and a few others. But I'm talking about people who are in the center, in the city of Asheville, who, like Mr. Bell said, don't have air conditioning. If we're collecting this money and people are donating to a fund, part of that fund should be set aside to address those needs. It's still the people who are most vulnerable that are being forgotten. And it's not just homeless people, it's people within the city of Asheville who don't have access to certain things, who don't have grocery stores close to them. Those are people that we also should be having conversations about and conversations with. And it's about making sure that our kids get what they need and working with people to think about how you set up a schedule during this social distancing and this school learning at home. What do we do? How do we help one another? How do we stay in contact, and particularly with those families that don't have internet access, so they can't get on Google Drive and they can't access the lessons and do all the things that need to be done.
You were a teacher, and I have to ask you this. If there's one point, get over as a point of advice for our community regarding having their children basically homeschooled, what would it be?
For me, the one point would be consistency. You know, when we look at school today, it's very different than when we were in school. And some parents look at the work and they're like, oh my gosh, that's a new math. I don't really know that math. Or, you know, this process is different or that process is different. During school to home learning, honestly, teachers should be reaching out to students, and hopefully after this spring break, there'll be a schedule put in place where teachers can call and check on students individually. But there needs to be a consistent routine that families are following, creating a space, however small it is, wherever it is, where there's a routine of this is our school time and this is what we do during that time.
Thank you.
Thank you, Libby. I'd like to ask Sheriff Miller just about, you serve us as our sheriff, but you are a person in this community, right? You live in this community, you work in this community. And I know sometimes that's really hard to balance. And so, what would you say as we think about all of the things that we've heard today around physical and social distancing, around the impacts that this is having on our community, whether it's from the perspective of our kids, our churches, our businesses, what would you say are the things that resonate with you most about how to support the African American community in getting to the other side of COVID-19?
Very interesting. I will start by saying Buncombe County has adopted this one Buncombe. One Buncombe has more than just this fun. One Buncombe is talking about how do we come together as a community to not only face COVID-19, but to face other issues that's faced, by our community. So again, a lot of what I've always said is a lot depends on our faith-based community. I know pastors can probably agree with this, but we have to have a real conversation, an honest conversation, and we have to look at how we know about the disparities that exist, and we could talk on and on about them, but what are we prepared and willing to do about them? And so when I think about the one Buncombe, I think that's where we need to start going to as our community as a whole, where everyone has input, everyone has the opportunity to say, how they feel, which is another good reason why I feel this is very positive what we're doing today. But also, we have to take action. And I've been saying all along about video and audio. Our audio and video needs to match. We can't keep talking about it. We got to be about it. We got to do something. And I'm calling upon the faith-based community to kind of bring this together so that we can now reach the places that haven't been reached, but just not depending solely on the faith-based community, but the one Buncombe as a whole. So I would just simply say working together, having a place to start, and have action-minded folks at the table that we can get something done.
Thank you, Sheriff Miller, and appreciate your very candid and honest response. I just wanted to let everybody know that is listening, we are having issues with our phone line. So please send your questions to ready@buncombe.org, or you can call 423-5500. Again, we're having issues with our phone line, so please send your questions to ready@buncombe.org, or you can call 828-250-5500. Again, 250-5500. You can also visit buncombecounty.org. Dr. Mullen, I'll turn it over to you to help us wrap things up.
Honestly, the panel is really interesting, and I feel like they're sitting on so much more information. And we have just enough time, if we go around to everyone just one more time, for you to fit in things that you may not have been able to say before. Can we start at the beginning again? Reverend Blunt?
Yes, I guess just my final point would be that as we continue to do ministry, that we do it in a way that is beneficial as far as continuing to be able to be relational, but at the same time, making sure that our people are safe. And again, things are changing every day, so what is that going to look like tomorrow? I don't know, but we've just got to stay ahead of it and give it our best shot.
Reverend Blunt, it's so obvious, no one mentioned it, and it has to be talked about. The number one thing we have to do is wash our hands. And I don't know how, that's not mine. We have to wash our hands.
Yes, that is very true, as my son reminds me to sing the alphabet as I am washing my hands. Dion, could you give us sort of your last thoughts or thoughts that you didn't get to share?
Yes, I wanted to again reiterate that anyone can call 211 just by dialing 211, and you can get someone on the phone to answer any question you may have. And I also wanted to give people the telephone number for the One Buncombe Fund, because that fund was established as a relief fund for individuals as well as for those who were small businesses. And that number is 828-250-5500, so that people can call and ask for information regarding the fund if they need assistance. And again, that number is 828-250-5500 for the One Buncombe Fund.
Thank you, Dion. Rod, any final words or thoughts that you want to share? Rod, are you still on with us? He may have had to drop off, so we'll move ahead with Felicia. Would you like to share final thoughts with us? I hope that we're not having any technical difficulties with the folks that are on our call.
I'm sorry.
Okay, all right.
This is Felicia.
All right.
I am so sorry. I'll be quick. I have to thank Dr. Mullins. I'll say he kind of stole my thunder. But what I want to say is that just keeping in mind that this impacts segment of our lives, faith, work, family, travel, our community. And sadly enough, inequities are just being amplified in the midst of this, and we know that. And so thinking about hand washing your hands with warm, soapy water for at least 30 seconds. I like to say physical distancing, because with my family, social distancing just didn't work. I was like, we got to keep our physical distance, but we can still engage and talk to each other socially. And so we got to stay a distance, but I may call you on FaceTime or whatever. Avoiding touching your face. Don't put your hands all over your face, because that's an easy way to get sick. Be kind, but treat everybody as if they might have the virus and you don't want to get it. Keeping yourself 6 feet away. And then the CDC has come out with a recent recommendation of making homemade cloth masks when you're out in public and considering that type of thing. So I have so much more to share, so I hope we'll have an opportunity to do this again. But those are the highlights. And right, Dr. Mullins, you're right. Wash those hands. You cannot wash your hands too much. Thank you so much.
Thank you. Brother Gene?
Yeah, I want us to remember just as we reacted to this situation, this virus, that we also need to be proactive when this ends and try to continue to make the lives of African Americans better. We do have the resources to do that, but we've got to work together to make it happen. Mm-hmm. So I would implore us to please think about continuing to do things. I know we know the problem, but we got to help people. So that's my last thing. Please.
Yes.
Thank you, Jen. Thank you.
Thank you. Libby?
I want to reiterate that we are offering emergency child care services at the YWCA, and we want to be able to help as many people as we possibly can. And so if you are a frontline worker or you know anyone that is that they are hurting for child care, if you will let them know that the YWCA is a resource. And just remember, if you don't have internet access, the best thing that your children can be doing at home is reading. And you don't have to have a computer to just sit down and read with a child. And just remember to be gracious and kind to one another. I'm a little passionate and I speak really harsh sometimes, but we are one Buncombe, and it is very important that all parts of Buncombe are being represented in the decision making and how we address this crisis.
Thank you, Libby. I really, really appreciate those words. And we will hear from Sheriff Miller.
So again, I just want to reiterate to the community that one, that law enforcement, we're definitely seeking voluntary compliance. And again, I want to tell everyone that this virus is really is serious. And I would hope that we don't wait until it's someone we know or someone in our family before we're willing and ready to follow the rules and take actions. So again, I just want to reiterate how serious this is, and that I would hope people understand we're all in this together, and it is truly one Buncombe.
Yes.
We all will be affected.
Thank you so much, Sheriff Miller. And yes, we are all in this together. We individually and collectively, we're all responsible for each other. I'd like to just take a moment to express my gratitude for being a part of this conversation today and having the privilege to co-moderate with Dr. Mullen. Just a couple of housekeeping items. Want to let you know that a recording of today's program will be available on buncombecounty.org and also on Buncombe County's Facebook page at buncombe.gov. For questions about information that you have heard today, particularly on COVID-19, you can call the Buncombe County Ready Team Call Center. That number is 828-419-0095. As we've also heard from Dion today, United Way of Asheville, and dialing 211, and you can ask any question. You can also reach out to Buncombe Health and Human Services at 828-250-5000 or 250-5500, buncombecounty.org, and again, their Facebook page is at buncombe.gov. Dr. Mullen?
Thank you, Lakeisha. You know, just two last thank yous, and this is almost as important as washing your hands, is the work to acknowledge the work that Zoe and Poku did in pulling this and organizing this unprecedented town hall meeting. And I'd like to thank her personally.
Absolutely.
As well as thanking John Hayes and using WRES as the voice of the community. You're irreplaceable, my brother. You're irreplaceable.
Yes.
This is all back to you. Can you have the final word, please? Brother Hayes. Oh, he's shy.
All right, thank you all so much, and we hope this is not the last conversation. Everybody, please continue to be well. Thank you.